What the heck are, well, screw that. Should cancel that. Darn it! Oh, this is embarrassing. You're an embarrassment. You know, patients are always like, I don't like getting root canals. Well, you know something? I don't like doing root canals, okay? All right? I don't enjoy them, okay? They're not fun for me either, okay? So how about maybe you follow the advice on the rest of my YouTube playlists and channels, such and so on, and then maybe you can decrease your chances of having to get a root canal, and then we can both be happier, right? Isn't that what we both want? To be happier? I'm sorry, I'll stop yelling now. It's just, I get emotional sometimes, and this is the dentist. I'm on a couch. Here we go. What the heck is a root canal? Technically, I should say root canal therapy. Your nerve in your tooth probably doesn't consider it therapy. It's therapy in the same way a lobotomy is therapy. You pretty much just rip the nerve out of there. You don't try to sweet talk it into stopping hurting. A root canal, what is it? All of our teeth have nerves in the center of them. How many Tootsie Pops does it take to get dental decay to the center of a tooth where the nerve is located? Why do we have nerves in our teeth? The nerves in our teeth send pain signals to our brains. Unfortunately, that's the only type of signal the nerves in our teeth can send. Pain. They can tell us there is sharp pain, they can tell us there is dull, achy pain. That's about it. Tooth nerves aren't that complicated. When you drink something cold, the tooth doesn't register it is cold, it just sends a pain signal. Pain signals can actually be helpful. They are a warning sign about potential problems. That's why our nervous system evolved. You know, pain serves a function to help us avoid more painful experiences that could harm us or, you know, cause death and things like that. Of course, when you're in the midst of having a toothache, you're probably not too thankful for that pain. I made a video all about easing toothaches at home. I'll link that in the video description. So a root canal is a tunnel through the center of the roots of your teeth that contains a nerve. That nerve can start hurting really badly if you get tooth decay that reaches down into it, or if you crack a tooth and the crack goes into the nerve chamber. So what is root canal therapy? Like I said at the beginning of the video, it's more or less a lobotomy for your tooth. We numb you up and then we go in there and pull the nerve out of the tooth. If you're tired of your tooth's personality, tired of your tooth being all extra, just give it a lobotomy, calm it down. We clean out and disinfect the root canal where the nerve used to be. We drain out infection from any bacteria that are there. Then we seal the canal back up so that bacteria and infection can't get back down in the root of the tooth and the jawbone anymore. Your tooth no longer has a nerve, so it doesn't hurt. Bacteria from your mouth can no longer funnel down through your tooth into the jawbone and cause infections or abscesses. Now, after a root canal, you should still take it easy on your tooth. I always tell patients to treat a root canal treated tooth like a sprained ankle. You wouldn't go running a marathon on a sprained ankle the day after you do it. Give it a few weeks. Softer foods, minimal chewing on that tooth while things heal up. You can alternate ibuprofen and acetaminophen if you have residual discomfort. The other thing about root canals is that you often want to protect these teeth with a crown. I have a video on dental crowns if you don't know what those are. Basically, it's a hard hat to protect your tooth while chewing. Not every root canal treated tooth needs a crown, but a lot of the time when you need a root canal on a tooth, it's because of a large amount of dental decay on a tooth or from a significant crack or fracture. The last thing you want to have happen after spending time and money on a root canal is to try to chew on a fragile tooth and have it fracture more and then have to remove the tooth. That's where crowns can come in handy. You know, lots of patients ask me, if I have a crown, does that mean I need a root canal? No, not usually. We put crowns on teeth without having to do root canals all the time. But when you need a root canal, in a lot of situations, it is smart to put a crown on that tooth afterwards. It just depends on how much healthy tooth structure is left after root canal therapy. Root canals. Why do you do them? You have a crack or dental decay down into the nerve of the tooth, you have a toothache, you have an infection in a tooth. That's why you would do it. Root canals, what is it? It's taking the nerve and blood vessels out of the center of the tooth, removing infection, cleaning it out, then sealing everything up so it doesn't get reinfected. How do you care for them afterward? a little ibuprofen, a little acetaminophen. That's Advil and Tylenol. You don't want to chew on these teeth right away afterwards. Ask your dentist if a crown is necessary to protect the tooth after a root canal for you. Who does root canals? Both general dentists and dental specialists called endodontists do root canal therapy. Molar root canals, the back teeth, are the most common. Often molars are the teeth that break down first because we use them to chew the most. Molar root canals, especially upper molars, are also the most difficult to treat. For the most part, this is going to be controversial, but I'm going to say it anyway, I'd recommend seeing an endodontist for molar root canals. There are general dentists that can do them and do them very well, but if you can afford it, I'd recommend seeing an endodontist. You're likely to have a smoother experience that way. Endodontists do root canals all day, every day. In general, they are better at them than your average general dentist will be. As with anything, there are exceptions to that statement, but if it were me in the chair, I'd want an endodontist doing any molar root canals on me. Just my 2 cents. This is where all the general dentists who love doing molar root canals attack me in the comments. I'm cool with it. You do you. Also, I should mention, lots of patients get very worried about root canals. They've heard that they can be very painful. The vast majority of the time, we can get you numb, no problem, for a root canal. If you have a really bad infection or inflamed nerve that's causing severe pain, occasionally getting you numb can be more difficult, but most of the time you will be completely numb for this. If your dentist or endodontist can't get you numb, which again is pretty unlikely, there are also sedation options. The good news either way is that once the nerve is out of there and any infection is drained, your horrible toothache is going to go away. But seriously, you should have minimal fear about not being able to get numb. We can almost always get you numb with the tools we have available today. If you want to avoid having root canals altogether, I would suggest checking out the Dental Health Tips playlist on my channel. My goal is to teach you how to prevent dental problems before they start. Trust me, it's easier than you think. If you want to learn more about root canals and see a bunch of cool x-rays of well-done root canal treatments, I know that's why all of you are here, you can check out @absendo on Instagram. I don't know, I guess he's got nice abs in addition to being really good at doing root canals. All right, turns out it's just his initials. Like, he lists his full name on his profile. It's Ahmed B. Salman and ABS. You just got to understand, sometimes I'm dumb, guys. I'm just a dumb person, and you got to live with that. You know, I mean, it was right there in front of me. Like, he wasn't hiding it. I might be the dumbest person alive. I don't know Dr. Salman. He didn't ask me to promote his Instagram, but he does a great job documenting cases, so he wins the prize today. If you're a root canal nerd, as common as such people are, check out his Instagram. The goal of these videos and the Dental Health Tips playlist on my channel is to set you up for success in a dental office. I know very well the common inefficiencies and costly pitfalls patients run into in dental offices. I want to help you avoid those. I want to set you up to be an ideal dental patient who knows how to find the ideal dental provider for you so that you can have an ideal dental experience. Now, I use the word ideal loosely because things in life go sideways in a hurry all the time, but I want to help decrease the likelihood that that happens to you. I'm a huge proponent of preventative medicine. You know, most dental problems can be avoided with simple, healthy habits at home. I want to help you build those simple habits to help reduce stress in the dental chair and help you avoid financial strain from healthcare expenses. I have a Dental Health Tips playlist on my channel and linked in the video description. That playlist is full of longer, more in-depth videos to give you guidance on how to avoid dental problems and keep a happier, healthier, more functional smile. By the way, I do stand-up comedy and I enjoy photography. Huh? What? Yeah, yup. Please subscribe to my channel if you want to know more about that. I'll be making videos involving dentistry, comedy, photography, basically anything I enjoy that I also think you will enjoy and find informative. I'm on Instagram @Comedic Exposure. You can check out my website if you want to find future info on comedy shows and albums I plan to produce. That's anotherlazymillennial.com. I'm also on TikTok @MikeTheDentist. Please like, share, subscribe to my brand. I'm not a person anymore, I'm just a brand. Please smell, taste, and feel my brand. It's a good brand. Thank you.